Hey guys, it's your pharmacist Leticia coming to you from my couch. This is day number 2 of quarantine. This is going to be a lengthy video. So with that said, I just want to talk to you 2 seconds about where to call and where to go if you have coronavirus symptoms. Do not rush to the ER if you're having a fever and a cough just to get tested. You're going to spread the virus to other people who are actually in there for emergencies. And there's no need for you to do that if you can just go elsewhere. So there's designated areas all over Pennsylvania that are going to test for the virus. You just have to call the number above or below, depending on where I'm posting this, and that is the Department of Health of Pennsylvania. You're going to tell them your symptoms, and they will guide you where to go. You can also call your doctor. Do not rush to the emergency room if it is not an emergency. So if you do not have shortness of breath or purple lips, do not rush to the emergency room. Now, if you can't hold down food or liquids, if you're rushing to the bathroom every 3 seconds and you are becoming lethargic and you need emergency help, go to the emergency room, call 911. If you're spiking high fevers, your cough and shortness of breath where you cannot breathe, you're calling 911 and going to the emergency room. That is a valid reason to go to the emergency room. If you just have a fever and a cough, and you just want to be tested, that is the emergency room. Stay away from it. Go to the designated areas. Call the number above or below and let them know your symptoms. They will guide you of what to do. I will also tell you what you can take at home because this is a virus. So all you can do with this virus is treat the symptoms. There's no cure. There's no antivirals. No antibiotics will help it because this is a virus. It's not bacterial. So asking your doctors for antibiotics to cure this virus is not going to do anything for you except create bacterial resistance. So stay away from antibiotics if you don't have a bacterial infection. So with that said, my little spiel, my disclaimer, anything I recommend, anything I tell you guys, do not take unless you get the approval from your doctor or your pharmacist. I don't know your medical condition. I don't know if you're allergic to any medication. I don't know the medications you are taking, so there could be interactions. Get the approval from your doctor or your pharmacist. And with that said, we're going to go into the first 2 that are the most common pain relievers and fever reducers. They are acetaminophen, which is your Tylenol, and ibuprofen. Ibuprofen is also Advil and Motrin. It's the same exact thing. So I go for the generics. They're cheaper and they do exactly the same thing for me. Some people like the brand. If you want to spend the money, it's up to you. Tylenol, acetaminophen, comes in 3 different strengths: 325, 500 milligrams, and 650 milligrams. So you are to take 1 to 2 tablets every 4 to 6 hours. This one gets broken down in the liver. With that said, if you have a liver condition, do not take Tylenol. Do not, unless you are directed by your doctor to do so. If you are drinking, and I know many of you are, this is like, I know you've all stocked up on beer and your wine and your liquors. Do not take this for a hangover. Do not take Tylenol for a pre-drink remedy that doesn't cause a hangover. No, Tylenol gets broken down the same exact pathway as alcohol, and it actually creates a toxin. So alcohol goes first, this lingers in your liver, and it starts to eat at your liver. And do not take it. Do not take this with drinking at all. That is a big, big no-no. This you should take with or without food. If you take it with food, it'll lessen the stomach upset that some people can get. But there's capsules and there's also tablets. It is up to you, your preference. Some people say that capsules work faster. I don't believe that to be true, with maybe minutes. Like this will work 5 minutes before your tablet works. But a lot of people, they like the liquid gels because they are easier to swallow. This, you can't take more than 4,000 milligrams a day, so because that will mess up your liver. it'll eat away at your liver. So if you didn't understand, if you didn't get a gist of anything, if you have a liver condition, do not take Tylenol. It works really well. If you have high blood pressure and you don't have a liver condition and your doctor says it's okay, this is good for people with high blood pressure, because ibuprofen is not good for people with high blood pressure. So this is your fever reducer and your painkiller if you have high blood pressure, but if you are okay liver-wise, all right? We have ibuprofen. Ibuprofen is also known as Advil and Motrin. It is 200 milligram tablet. You can take up to 16 tablets a day. It says do not exceed 6 tablets on the bottle, so follow what the bottle says. But you can take up to 3,200 milligrams a day of ibuprofen. People with ulcers, with any gastric intestinal issues, do not take ibuprofen unless you're directed by a doctor to do so. You can take 1 to 2 tablets every 4 to 6 hours. You want to take this with food or a glass of milk. You want to coat that stomach just for like a protective lining, because this will eat at the lining of your stomach and cause ulcers. I love ibuprofen. It's also an anti-inflammatory. So if you have any kind of inflammation, muscle sprains, ibuprofen is a really good drug to take. It's doesn't have any steroids in it, but it does something similar that a steroid does with being an anti-inflammatory. With that said, people with high blood pressure, this is not a good medication for you. It can increase your blood pressure. Also, this is broken down in the kidneys, so anybody with kidney conditions, do not take this unless directed by a doctor. This is really good for a pain reliever. Fever reducer is your ibuprofens, your Advils, and your Motrins. Tylenol is also really good for a fever reducer and pain reliever, so acetaminophen or Tylenol. Ibuprofen is Motrin and Advil. So these are your 2 main ingredients if you have a fever and if you have body aches. Those are what you want to take. If now you are having a cough or nasal congestion and a fever, they're combo drugs. So the one drug that I love when I'm sick is my Theraflu. This is my combo drug. This is actually a packet. You dissolve a packet in hot water and you drink it within 15 minutes. So this has my acetaminophen in it already. It's your Tylenol. It has dextromethorphan. Dextromethorphan is also known as Robitussin and Delsum. So it also is in Mucinex DM. Anytime you see DM on a medication bottle or label, that means it's dextromethorphan, okay? So when you see Mucinex DM, Robitussin DM, it has dextromethorphan in it, okay? Phenylephrine is your nasal decongestant. So my high blood pressure patients, you guys cannot take any products that say nasal decongestant. All of your nasal decongestants, phenylephrine and Sudafed. Sudafed is found behind the counter at the pharmacy. You need your driver's license to purchase it. Phenylephrine will increase your blood pressure. So this is not a good medication for you if you have uncontrolled high blood pressure, okay? Stay away from combo drugs that say nasal decongestants. Acetaminophen and dextromethorphan are okay for people with high blood pressure. Phenylephrine is not, so this is not okay for you to take. There's a daytime and a nighttime. The nighttime just swaps the dextromethorphan for diphenhydramine, and the diphenhydramine is Benadryl. All right, guys, so in this combo drug, you see that there is Tylenol. You would not take this Tylenol and this Tylenol because that is going to ruin your liver. A lot of people are like, oh, I take Tylenol and I also take Dayquil. Dayquil has the same exact ingredients as your daytime Theraflu. So now they're doubling up on Tylenol. I see this so many times in the pharmacy. Check your labels. Your labels will tell you what the active ingredient is. So before you take anything, check your label with the medication you're going to take. So ibuprofen and this medication is probably okay to take. I would take this first. If this isn't helping with your fever or your body aches, then you can go ahead and take ibuprofen because ibuprofen is not found in here. But other than that, try to stick to one combo drug. The combo drugs usually have everything you need. You don't need to add something else, okay? So I bought Theraflu, I bought Dayquil, and I bought NyQuil. They are exactly the same thing as Theraflu, except one's soft gels and one is a packet where I drink. I like this one. I bought these for my family, but if I do get sick, I like drinking my hot, I pretend it's hot tea. So with combo drugs, you also have your Mucinex. A lot of people ask me about Mucinex. Mucinex is to be taken with a large glass of water. Mucinex is your guaifenesin. Guaifenesin, what it does is it thins out your mucus. So if you have a lot of chest congestion and you are producing mucus but it's not coming up, go ahead and take Mucinex, okay? That will help with the thinning of your mucus, and it'll help bring everything up that needs to come up. If you have a cough and your cough is dry and you're not producing any mucus and you don't feel any chest congestion, you can just take Delsum. That is your dextromethorphan, okay? If you have now a cough and you're producing stuff from this cough, you can go ahead and take Mucinex DM or Robitussin DM or guaifenesin with dextromethorphan. These are all medications that you will find over the counter. I would ask the pharmacist about them. You can take, so if you're taking Mucinex DM and you have a fever, you can go ahead and take Mucinex DM with either ibuprofen or with Tylenol. If there are combination drugs, there's a lot of combination drugs out there, but these are the main ones. You're going to see your dextromethorphan, which is your cough suppressant, your antihistamines. So you're going to see a lot of antihistamine. An antihistamine means that it's going to reduce the mucus production. It'll reduce watery eyes, itchy nose. So it's more of an allergy medication. But these antihistamines can help when you are having flu-like symptoms or when you are have a cold. So it helps reduce that mucus production. Antihistamines can be used with people with high blood pressure. Dextromethorphan can be used with people with high blood pressure. Tylenol is used with people with high blood pressure. Those three are okay for you with high blood pressure to use. You can also use Mucinex DM or just plain old Mucinex if you have high blood pressure. There is a medication out there called Coricidin. Coricidin is for people with a heart condition and with people with high blood pressure. These are your combo drugs for people with high blood pressure. I say high blood pressure a lot because a lot of people have asked me, I have high blood pressure, what can I take, what can I take? The one thing you cannot take if you have high blood pressure is nasal decongestants. I know it's awful that you can't take them, but that's because they are going to spike up your blood pressure extremely high and you don't want that. So if it's not controlled, or if you just have borderline high blood pressure, stray away from your nasal decongestants. If you want to do something natural, simply saline. I actually have my son's. This is really good. There's also the neti pot, which is the same thing. It's saline packets. You mix it in lukewarm water. You stand over the sink and you squeeze all that water up, and it goes into your sinuses and out the other side. And it's supposed to just irrigate all of that mucus out, and then you switch sides and you do it. You can also do it with saline. You just stick it in your nose and squeeze until it comes out the other side, and then on the opposite side. So that is talked for 13 minutes. I think this is more than enough. If you guys have any questions, just DM me. A lot of you have been doing so, and that's okay. I will get to you as soon as I can. I love making these. I love spreading all this information. So the more you can share this, the more likes you put on it. I love it, and I will continue to do more. Again, if you have any questions, just private message me or message me, comment below. It doesn't matter. But everyone stay safe, stay inside, stop this spread. If you have flu-like symptoms or coronavirus symptoms, call your doctor before you go anywhere. They will probably tell you if you don't need to rush to the emergency room. So if you are okay breathing, if you're not having shortness of breath or purple lips, you are okay to self-quarantine inside your house and treat the symptoms. Now you know a little bit about the medication. Don't double up on medication. If you guys have any questions at any time, just feel free to reach out, okay? You take care, enjoy your day, and I will talk to you soon. Mwah.